All right, so after reading chapter 11 and chapter 12, these two chapters were kind of some of the most important chapters of the book because it correlates gun violence with mental health. And I think that's one of the two topics that are like the talking point when it comes to mental health, especially gun violence. So the first paragraph talks about Emmy Betts. She's a emergency physician who lives near Denver, Colorado, and has had her eyes open to the link between violence and self-harm for some time. She sees at least one or two patients every day who are suicidal, but she realizes the limits of a medical industrial complex designed to move the meat, a curt phrase in the Sactual novel, The House of God, that describes the daily struggle of physicians working inside America's hospitals in the 1970s. The concept of seeing as many patients as possible and moving quickly from case to case is arguably worse now than half a century later. Then she talks right down here. She said, amid the coronavirus pandemic, the situation only worsened, with patients lingering in the emergency departments for days or even weeks. In extreme cases, according to Dr. Chris Kang, a former president of the American College of Emergency Physicians, some individuals with mental health issues have been stuck in the emergency departments for over 6 months. Those patients who may be suffering from psychotic crisis due to schizophrenia or a bout of suicidality because of a major depression or bipolar disorder are considered lucky if they receive a moment more than the 12 minutes on average a patient gets with an emergency physician. Patients with serious psychiatric concerns sometimes languish for hours or even days as they wait for specialized psychiatric care. This creates a sense of powerlessness among healthcare workers who become disillusioned with the health quote-unquote care system. This leads to burnout, depression, and in the case of some 400 or more healthcare workers a year, the end of life by suicide. So just even that in particular, it talks about obviously the emergency physician part of how important it is that we take our time with people who show these suicidal tendencies, or they show that they're just slightly not okay. It just shows that we need to spend more time with these people, because the more time we spend, the less it puts on other people. So then it talks about policy prescription. So mental health checks do not necessarily save lives, but permits and licenses to purchase firearms do. So then the National Alliance of Mental Illness reports that 1 in 5 adults experience mental illness every year, with 1 in 25 people experience a severe mental illness that impairs or limits major life activities. The Brady Act placed restrictions on individuals with mental illness or intellectual disabilities that are so severe that they have been committed to a mental institution. This is but a fraction of the population of Americans with diagnosed mental illness. However, physicians must always balance public safety and the safety of our patients with protection of their human rights, and must avoid stigmatizing people who are afflicted with diseases that have resulted in terrible acts against humanity. And then another thing right here, this is probably the most important part that hit me hard, I think. It says most states require that either mental health records or court records be submitted to either a state or federal repository so that individuals who would be disqualified due to severe mental health issues would be listed in the NICS database. However, the federal government cannot universally mandate reporting. Following certain tragic incidents, such as the Virginia Tech shooting of 2007, some states have ramped up their own reporting requirements. And as reporting has increased in recent years, the percentage of potential firearm sales that have been rejected due to this particular provision of the Brady Act has risen. Thus, it is reasonable to expect that important outcomes such as firearm suicides would have declined. Unfortunately, the most up-to-date data failed to support that hypothesis. So then researchers who explore the subject of violent crime among individuals with mental conditions commonly note that individuals with mental health issues are much more likely to be victims of violent crime than the perpetrators. Although the science of gun policy finds that mental health checks have the beneficial effect of reducing arrests for violent crime, mental health checks do not have a significant impact on either firearm homicides or firearm suicides.